that a lot for my patients, and Barber kind of touched on this earlier by saying that glaucoma is the silent thief of sight, kind of like hypertension is the silent killer. So silent means there's not a lot of symptoms early on. And so it's not a lot for patients to look out for. We'll talk about a lot as we go through, but that's why it's important for you to get regular eye exams, because Dr. Barber and I, optometrists and ophthalmologists, we're screening for these things. We kind of know what to look for. That's why we ask these detailed histories when you come in. We don't want to get all in your business, but we really need to know what things are being managed, what you're taking for as medications, other health issues that it can influence your risk for having glaucoma. But one, in the beginning, early, not a lot of symptoms. But there are some symptoms that may present some of the more moderate advanced phase, because unfortunately I have patients come in who are not in the early phases. And so you can have trouble seeing in your blind spot. So I call that your functional vision. So over here, you get over to, you don't see a car that's in your blind spot, or if someone leaves the cabinet door open, you don't notice that and you walk into it, or someone walks up to say something to you and you don't know until they're like on you. So your functional vision, so trouble in your blind spot. Also, you can get some halos and some glare at night, or some overall blurry vision. But typically, if you notice those things, you're more in the moderate to advanced. And so hopefully, I'm sure Dr. Barber's goal as well is to not you experience those, right? So we want to get out of this, get a regular eye exam so that we can screen and catch things early. One part about it being where it's not a lot of symptoms, sometimes it makes it harder for patients to be compliant, right? I had some patients today who were having glaucoma checks, we're checking their eye pressure, and they're like, I see fine, doc. You do. I don't feel anything. You won't. And so I know it's hard for you to listen, for me to tell you to take this regularly. I'm not sure. I'm seeing myself in purple. I don't know if you guys are seeing this on my camera.
Yes, sir. We are. I was like, okay, purple rain.
I'm feeling purple today. And so it's hard for patients to kind of be compliant if they don't feel any different or see any different. And so the takeaway in the beginning, you may not have vast changes in your vision, and that's good, because our goal is to maintain your overall sight throughout this diagnosis to help you manage it where you don't lose vision.